The United States Center for Disease Control and Prevention states that over 2,600 people have been hospitalized with vaping-related illnesses. Today, I'm going to discuss the epidemic that is the young adult e-smokers of Arkansas. Three aspects I'm going to talk about in my speech today are the statistics of young adult e-smokers in Arkansas, the comparison of an e-cigarette and a combustible cigarette, which is just a regular cigarette, and the health consequences that follow using these devices. I have had my own experience watching family members and loved ones battle with nicotine addiction from regular cigarettes, so I thought it would be wise to educate myself on the dangers of e-cigarettes. As college students, you're going to want to listen to my speech because we are constantly surrounded by different substances and temptation, and it's important to know the facts about these substances. The vaping industry has been on the rise for the past few years and is only projected to continue to rise in the next 10 years. Arkansas is a state that should be especially in concern because an article from the CDC discusses different state statistics states that Arkansas, Kentucky, and Tennessee were among the states with the highest prevalence for all three assessed tobacco product types, meaning smokeless tobacco, regular tobacco, and e-cigarette tobacco. As of March 5th, 2020, in Arkansas, there are 8 confirmed cases and 15 probable cases of lung disease from vaping. So what's the difference between an e-cigarette and a regular cigarette? Besides the obvious that one is electric and one is combustible, there's a certain appeal that comes along with e-cigarettes, such as their sleek design, they're more inconspicuous and easier to conceal. Also, they have fruity flavored juices that you smoke, supposedly is more attractive than the taste and smell of a regular cigarette. E-cigarettes are advertised as a way to help quit smoking combustible cigarettes, although the FDA does not approve e-cigarettes as a safer alternative or a way to quit smoking regular cigarettes. Nicole DeFutis of the Boston Globe writes, "Maybe e-cigarettes won't kill hundreds of thousands of people per year the way a tobacco cigarette does, but when teens vape, almost 31% of them pick up smoking within the next 6 months." Both e-cigarettes and regular cigarettes have dangerous chemicals in them, but the CDC has proven that e-cigarettes and regular cigarettes both have cancer-causing chemicals inside of them. One difference that e-cigarettes have is that you can choose the type of nicotine that you put in some of the devices, and the nicotine concentration is a lot higher in some cases than a regular cigarette. For example, according to a news article from the writers of the Truth Initiative, 1 Juul pod has the same amount of nicotine as about 20 cigarettes. So let's learn about the health effects of using e-cigarettes. Just to name a few of the type of chemicals inside of an e-cigarette are nicotine, chemical compounds, cancer carcinogens, heavy metals, and fine particles that get trapped in the lungs. Just concerning the nicotine, the CDC says that acute exposure can be toxic. Children and adults have been poisoned by swallowing, breathing, or absorbing e-cigarette liquid through the skin or eyes. This combination of unhealthy substances has put a lot of people in the hospital. Megan Middleton of the Red and Black writes that 80% of patients hospitalized were under 35 years old, and 70% of those patients were actually male. There has also been 68 deaths confirmed in the United States attributed to vaping. You also run the risk when using e-cigarettes of them defecting. If it is a defective device, it could explode, whether it's plugged in or it's currently being used. When people vape for a long time, their lungs become clouded with all the different chemicals and particles, and if you were to go to the doctor, sometimes it's hard to tell in the scans, like this one, what is even going on. Although, once you quit smoking, in only 20 minutes, heart circulation and blood pressure normalizes. In only one day, your risk of heart attack declines significantly. In 3 days, the nicotine is out of your system, and this is when the cravings start to cease. In 1 month, your lung capacity is noticeably increased, and in 9 months, your lungs can fight off infectious diseases again. So today I have talked to you about the statistics of e-cigarette smoking in Arkansas, the comparison between an e-cigarette and a combustible cigarette, and the health effects that are caused by using these types of devices. So next time when you go to reach for your device, maybe you'll think about those 2,600 people who were hospitalized. Thank you.